Good evening, everyone, or good morning if you're in Australia, as my wonderful co host is today. We are
Good
going to be
morning.
talking, we're going to be talking about neurodiversity in the healthcare system. And this is going to be an international conversation about this topic. So feel free to join in, drop your comments, ask your questions, and we will be, and if you want to share a story, do that too. And we'll discuss your story too. So, Nicci, please introduce yourself.
I'm Nicci Richman. Thank you for having me on today. I'm a neurodiversity consultant in Australia, and my focus is on embracing and enhancing neurodiversity in the workplace. So today we're talking about a topic that is more personal through around my personal experiences and my family's experiences. And it also does feed into the work that I do because I
Of
do work
course.
with health professionals and I do education, workplace training around these things. So it's
Love
something
it.
I'm very passionate about.
And welcome. And we met because of neurodiversity. We did.
Yeah.
I think you found me on a post or a video or something, and then we connected. And I'm so very happy. And for anybody watching who doesn't know me, I'm Catherine McCord. I run a national people operations consulting business. We specialize in neurodiversity. So this is also a very poignant topic for me. And I also have a show, Supermania, that centers around neurodiversity and mental health. So and Nicci and I have become quite good friends.
I love it.
over bonding over neurodiversity and sometimes sad things that have happened in our lives. So I want to dive right into talking about. So we're talking about neurodiversity in healthcare, and for years. People are aware of some of the really old stuff that happened, like people with mental health conditions being beaten, being tortured, being electrocuted, things like this. So people being locked up for life and all they needed was simple care. So people are aware of those kinds of things, but a lot of people think that all of that is gone now and that everything is super simple now, but that's not the case. So tell us a little bit about the story that prompted this live.
The story that prompted this live is it focuses on a 16-year-old, a very close um, person to me, and they were in distress and needed some mental health care, and went in for inpatient care, and they're neurodivergent. So the experience, they ended up staying there not even a night because the experience was so psychologically unsafe for them that they luckily the person who took them recognized that it wasn't safe and that they
Good.
needed to go. Yeah. So in terms of not safe, when we talk about our neurodivergent neurokin, the environment, it needs to start right from the environment. So the
Yes.
environment there was not conducive. There wasn't an explanation of what would happen to that person. There was being left alone with no information. Because it's COVID, there are COVID regulations, so they couldn't take their caregiver with them, and they were left to navigate the whole hospital system
And
on
so
their own.
no information. I remember when you very first sent me the story, you talked about the no information. Oh, somebody did ask, are we recording? Yes, we are recording. Um, but so no information, which I want to hit on that for a moment because people might not realize why that's so frightening to an adolescent neurodivergent person. So can you
Mm.
elaborate a little bit more about some of the things that this person experienced?
Yeah, so being left in a waiting room with no communication, what was going to happen next?
For hours.
For hours. What they could expect, why they were waiting there. They were given a lot of forms to fill out that normally their parent would fill out. That's with executive functioning, that's something that is a challenge for
And I
some
was
people.
going to hit on this. So this particular
Yeah.
person, to my understanding, this forms are something that this person struggles with.
Yes.
So,
Yeah.
and when that was communicated, what happened? when this person said that? What happened?
So they were texting their caregiver the whole time saying, how do I do this? I'm frightened, because the caregiver couldn't be with them. So they were receiving instructions by text. And so the instruction was, go and ask the nurse to help you. But the nurses, and it's the system, they're busy. They've got to hit their KPIs, and their KPIs are about pushing the people through the door. They're not KPIs on empathy and connection and safety, psychological safety. So, the nurse couldn't explain. They didn't have time to explain. They just kept showing, sign that, sign that, sign that. And the person didn't know what they were signing, why they were signing it. It could have been, who knows what it could have been, and to an anxious mind, that is frightening.
Gosh, yes.
Then they were directed to find their way to pathology. In a hospital they'd never been to before. They don't have great navigation skills. And so just the fear of trying to find their way through this hospital with, and going to have an injection, they're going to have blood taken, which they'd never done on their own either.
Right.
So,
and this whole time, nobody physically escorting, nobody helping,
so
really.
The text messages were, so the caregiver was very helping each step of the way via text.
But not physically. I mean, there was nobody physically with the person.
Yeah. So the nurse, when they went off shift, so they didn't have time to do it during their work time. So when they finished their shift, they escorted them there, and then they were left to have the blood test and then find their way back on their own.
And then this is the part that really killed me when you told me the story, was what happened when this person finally saw the doctor. This is the part that just slayed me. So can you tell us what happened at that point?
So the psychiatrist, that they did, okay, so you would think that if a psychiatrist says, yes, I can help this person, and they take them into the hospital, that they can help this person, and that they know how to work with a person with the challenges that they were experiencing. But they sat there with their arms folded and looked at them and said, so what do I need to know about you? And the child, the adolescent, was just like, what do you mean? What do I need to know about you? And it was, can you explain to me, what do you need to hear from me? I'm autistic. I need you to ask questions that are more tailored. I was actually quite impressed that the person would,
Right. That's actually pretty good self-advocacy. Way to go.
Yeah. And
way to go.
This is what I need from you as my psychiatrist, so that I can answer the questions properly. But they didn't ever clarify what they needed, and it just became this confrontational conversation, and the psychiatrist, it was very confronting. It wasn't a supportive environment. It wasn't it was pretty much, you're on your own. You've got to be able to do hard things.
And I want to hit on that real quick, because I think it's an important aspect to remember. So this person, this very young teenage person who is brave enough to say, yes, I need this help. This is something that I need to do to get better, which is an extraordinary thing that even most adults struggle to do. This very brave person goes in there, and for good reason can't take their caregiver. Like, I'm not going to bash that part of it. I understand, the COVID, but so then goes in by themselves, entirely on their own. And every step of the way, when there was a fight and there was, no, I need this, and people ignoring that. And as someone who grew up around healthcare professionals, nurses, and now mental health professionals, things like that, this is particularly disturbing to me, because the majority of that job is empathy and compassion. That's the majority of the job. It's about it's about making sure that the patient is taken care of. And if they need help, you help them. This is just
Yeah.
101. This is not like it's icing on the cake kind of skill. This is a basic skill that is
Yeah.
required in this job. And then the fact that the doctor, the professional, the most senior person, educationally and, work-wise in the place, just completely dismissed very valid clarification, requests and reaches for help. And my sister, who is a mental health professional, she's extraordinary, and empathy was born in to her. She's had empathy since she was a child, and she specializes now working with adolescents. That's kind of her specialty. And we talk a lot about the importance of reaching and accepting reaches, and especially for people in the mental health world. So this person reached, and that psychiatrist did not accept that reach, and I can't imagine the trauma.
Yes. And that's the thing. It mightn't sound like a big thing, but it's huge. It layers on trauma when there's already trauma that exists. And when people reach out for mental health help, they're already traumatized, and we don't want to layer that trauma. I've spoken to other psychiatrists since then. I've spoken to health professionals, and they've said that, you learn the basics of how to ask a good question.
Yes.
And this is in the private healthcare system too. So I think, the parent had thought that, well, private and they specialize in youth, then this will be great. This is just what we need
Right.
to help our child. So it's really sad that it added, instead of providing the help that was needed, it added another layer of trauma. So the adolescent then ended up having, going to their room and just having melting down and sobbing and being alone in their fear and their grief. And so when the caregiver met them for visiting hours, they saw that they were looking like this, and so they spoke with one of the nurses and asked, what experience does this place have with autistic people? And the response was, oh, we've had some through the years.
Oh gosh.
There wasn't a oh yes, we provide support in this way. It was a very alien.
Yeah. It's like, oh yeah, we've seen a couple. It's like, okay, these aren't fireflies. These are humans that I need you to provide care to. Please pay attention to this. And it's baffling to me that in that setting, and this is not the only story that I've heard like this. In fact, I'll share a couple of stories here in a minute. But this is not a lone experience, and this is not just an Australia based problem. But I do want to take this moment because I found this so very interesting. So I did a lot of research before this, and this is something that I found on an Australian government website from the Australian Charter of Healthcare Rights. It says the Australian government commits to international agreements about human rights, which recognize everyone's right to have the highest possible standard of physical and mental health. And then this. So
and in the private sector too, and I do want to say this isn't about bashing.
No,
I recognize every system is overloaded. We're having a mental health crisis across the world.
Yes.
So, but it's more that there are some basics. There's some basics that have been missed, and that place in particular, they don't have full rooms.
No.
They've got beds that are going untended. And to me, if I think about that from a business perspective, even from a business model, that's not a great business model. So
No.
it's a really good argument to say, hey, we're not doing something. There is something we're not getting right.
Something
here.
is amiss here, and it's your patient care.
And well, that's it. And so we can fix that. That can be fixed. It's
very
there's
easily.
a really great opportunity for that health for that hospital to shift their, do a paradigm shift. Look at the neurodiversity paradigm, train their staff, provide that environment, and then, from a business perspective, doing the work that I do, I always have to think about that bottom line as well. That there's actually a really great business opportunity here that is being missed because their KPIs are being based on number of people who see a psychiatrist, number of people who get their blood tests, number who see the GP. It's all very hard KPIs. It's not the empathy, and you can measure the connection. You can measure the connection that people have. It's not hard.
It's not actually. And I know of a hospital here in the States that one of my family members works for that does an excellent job of measuring that KPI. And they very much focus during the patient stay, starting from their check-in experience all the way through, and then afterwards. And they have people that come visit them whose whole job is just to sit there and be compassionate and empathy and empathize with them and care for them. And it's really extraordinary. It's a really cool program. And because of that, they're a huge healthcare system and wildly beloved. I don't think I've ever heard an unkind word. That's Baylor Scott and White, by the way, in Texas. So go Baylor Scott and White. That's a shout out for them. Their pastoral care. Excuse me. Sorry. Their pastoral care program is not just religious. They come out and just do basic care with the patients and check on them and care for them. And it's really a beautiful thing. So it's wonderful. It really is. And so kind of to your point, so on the business side, because this is also my world as well from a different perspective, but also my world as well. So neurodiverse people, from autism to dyslexia to bipolar, and all the way to all of our beautiful neurodiversities in the world, we make up almost a third of the population, right at about a third. So this is not a teeny little section of the world. This is a population that you need to work with and to engage and to understand. And especially if you're in healthcare, for the love of God, please learn neurodiversity. Another place I recently saw this make a really just wow impact. This is actually a story that came across my desk this week after we had decided to do this live. And I had a lawyer who has autism reach out to me and talk to me about how he was just sitting in a council that decided not to side with the man because he was not bipolar enough or disabled enough to have been discriminated against by his employer. Wow. Here in the United States, that happened. Yeah. So I just want to point out, it's not just an Australia thing. I just wanted to this is an international thing here.
Yeah. So I recognize that Australia, I've always thought of us as being fantastic with healthcare.
Overall.
Yeah. I mean, we're very fortunate. We've got Medicare, we've got the NDIS to support those who have a diagnosis and sufficiently enough.
Yeah, and what does that even mean? I want to be like, what is bipolar enough? What is that? I can't even begin. I'm bipolar, but what does that mean? Am I bipolar enough? What does that even mean?
How disabling is it for you? And that's the thing, the neurodiversity paradigm shifts away from the functional levels. It shifts away from disordered speaking and from high functioning, low functioning, because those functioning labels don't take into account the experience of the person. And the person's experience can change. It fluctuates through seasons, through times in a person's life, through complexities that might be happening. So you might be bipolar enough sometimes.
Trust me, there are days I'm real bipolar. All of it, all of the bipolar.
And other times it's just like, and yeah, it's it's an ableist way of speaking, isn't it?
It is. It
It's
is.
not considering that needs change, abilities change. You know, how many spoons you have at any one time. Do you talk about spoons?
Oh,
You
I remember you talking to me and I found this very fascinating. So could you explain the spoons? Because I loved this.
well, the spoons, it comes from it's I can't even remember where it comes from, but good morning ADHD. But the spoon analogy is that everybody is given a certain amount of spoons to start their day. So say I have 10 spoons. For me, getting up, having a shower, having breakfast, that's what I've done this morning. That's not hard for me. I've probably used up 1 spoon, maybe. Speaking with you, getting my kids ready for school after this, that might take another 3 spoons.
It's a
Having a
lot of
really
energy.
having a really hard conversation for me, that might take 5 spoons. So I might get through half of the day and I've got 1 spoon left, and so it's an energy bank, and
Right.
my energy is just depleted. So everybody's energy is different. Some people, for some neurodivergent people, having a shower and washing your hair and putting your makeup
It's a
on,
lot.
it's a lot to do, and it can use a lot of spoons, and people have to use their spoons wisely.
Yes.
So if you're going through a period of life where your spoons are depleted rapidly, then you're going to get to that burnout stage, and that's when, for example, your bipolar might become enough to be because
I
we're,
just love it. Enough.
we're out of spoons, and burnout
We're out.
happens.
And to
So
your point, I've gone through a very interesting experience lately. So I always joke my body is secretly 80 something years old. I have more. I once literally had an insurance company swear they had my age wrong because of the number of health conditions that I had. It was very funny. They actually called me to correct my age. It was hysterical. And then felt
wow.
very bad. Yeah, and then they felt really bad. I was like, no, it's okay. So one of the things right now that's kind of created a shift with me is that things that are daily activities, because of the heart conditions and the heart problems that I'm having, they're taking more spoons for me. It's taking more of my energy. So right now, a show might take maybe 1 spoon. It's not a whole lot. And then a shower will take 3 or 4, which is ridiculous, but that's what it is right now.
Well, that's it. That's the reality.
Yeah, just because of where I am. There are days that, when I'm in a down cycle of my bipolar and I'm having depression, that things like a show will take 4 or 5 spoons because I'm like, oh, this is just not what I feel like doing right now. And it's just so exhausting for me. So to your point, it really does shift. And I think that's one thing that people need to start understanding about both neuro and physical diversity, is that every day is different and every diagnosis for every person is different. It's not the same. My bipolar is not the same as your friend that we've spoken about's bipolar, which is not the same as another friend of mine's bipolar. It's all different. And it's the same thing for autism and ADHD.
For everything. Yeah, it's
Yeah, everything, all the neurodiversities.
yeah, it's we talk about people when I only discovered that I'm autistic. I discovered that last year. So, at the ripe old age of, well, I'm not old, the ripe age of 47.
Great age.
I discovered that. It's a great age, yes. And people who I told about it would say, oh, but you must be high functioning. And they were trying to make me feel better about it.
Bless their hearts, they were.
Bless their hearts. And this is what I wanted to talk about, is how well-meaning people, when we think, so when we talk about neurodiversity, we're talking about a beautiful paradigm shift that needed to happen. But there are people left in the pathological, in the medical model. So those beautiful people who were trying to make me feel better were thinking, they were in the pathological, that this is a problem, this is something that needs to be cured, this is a terrible thing for you to have found out.
Nope.
Whereas for me, I have met so many amazing autistic people. I love the communication style of autistic people.
Same.
I love the passions. I totally trust the information that comes from my autistic friends. I know it's spot on information.
I love autism so much that I literally married it.
And so did I, without realizing it as well.
See, there you go.
Like attracts like. That's the whole model. You know, when we're looking at the health system, we have people who are stuck in that pathological, in that medical model where it's about a problem. So for my child, when they were diagnosed as autistic, the first thing was it was about, this is a problem. And the beautiful psychologist said, let's not tell her about it because it's going to impact her career prospects. It's going to impact her life too much. We don't want
Oh my goodness.
And so she was saying it because she recognized the stigma and the stereotypes. Right. And the other stereotyping that at that time, so that was, gosh, 7 or 8 years ago now. But at the time she said, well, it's predominantly genetic. So it's not you. She goes, it's not you because you're too social and you've got great eye contact. Once again, we're going for the stereotypes.
Yeah.
And then she said we can blame the father. So,
oh, that's an ugly word.
I know. And so we started with this pathological model, and this is where, you know, we want to see change in the health system.
Yeah.
Because from that pathological model, it was, this child needs these therapies. This is a problem that needs to be fixed. And as parents, we find that we're gaslit. You know, we don't are taught not to trust our opinion because the professionals know best.
Right.
And through doing that, it creates trauma for our children because we are not listening to their innate needs. We are following professionals' advice, which is, you know, advice that I've heard, and other parents, I hear lots of stories from parents, and we're told your child's manipulating you. They're choosing these behaviors.
Oh yeah, we've talked about that.
and we are led to believe that our child is a problem. And then when I'm so grateful forever for discovering the person I discovered. I'm going to say Christy Forbes, because she changed she taught me about neurodiversity and the paradigm shift, and just loving your children exactly as they are.
Exactly how they are. And I don't think, I want to be clear, because I know you and I have talked about this before, so I know that you share this. We don't hate doctors. We don't think that they're trying to be maliceful. We don't think that they're trying to be harmful. And this is how they were taught. They were taught problem fix, problem fix, problem fix. But as more and more education is coming out and more studies are being done on autism, dyslexia, bipolar, ADHD is another really big one, having a lot of work done around it, and a lot of the other neurodiversities as well, is that including like Tourette, dyspraxia, all of that, is that it's not a problem to be fixed. It's just different. It's just a different way that this person processes information. For instance, there's a common misconception that dyslexia is a learning disability. Well, I don't like that term because people with dyslexia learn just fine. They just have to learn differently than other people. So it is an information processing difference, but it's not, they're not incapable of learning. And the label that's been placed on it makes it sound like they can't learn effectively. And that's completely untrue. That's completely untrue. And the same thing with ADHD. I mean, how many times, ADHD kids are such a pain in the classroom. And let me tell you, as someone who has struggled for years to train ADHD people, because my neurodiversities in that just do this. I love working with ADHD people. I have great ADHD colleagues and friends, but training ADHD people has took me years to master. But let me tell you, that's on you, not them. When you figure out how to do it right, they do just fine.
Yeah.
They do
Yeah.
just fine. By the way, number one tip on that, ask them what they need.
Exactly. I don't know, isn't it?
It so works. It so works. And I just did a post on the terminology thing and about the dangers of using words like illness and disorder,
Disorder.
because those words have very specific, not just denotations, which is the dictionary definition, of course, but a connotation. So an emotional type response to that word. So when you say illness, people automatically go, oh, they're sick. There's something wrong with them. When you say disorder, the actual meaning of that word is that you can't function properly. Well,
Yeah.
I function just fine, but I have tons of disorders. So I don't find the terminology to be very appropriate. So I think it's time to shift. And that's why I started using the term neurodiversity and physical diversity. And I will explain to people, I have physical diversities and neurodiversities. I don't have disabilities. I don't consider myself disabled. Now, some people do. We were talking about that variance. Some people do. So it's both, right?
Yes. Yes. Some people, there are deficits. Oh, what's Ange saying?
And she said, I can read, but I've had doctors tell me because I can, and I'm successful, I've successfully completed a degree that I can't be dyslexic. Well, that's just not right.
Yeah.
That's just incorrect.
People that I've met, I've got a friend who, because she's in her 50s and she discovered last year she's dyslexic. So how do we get through life without discovering this? It's because we are brilliant.
Because we can mask, which is unhealthy, but we can.
We can mask, but we also find strategies. We find strategies to help ourselves. And I mean, I discovered my ADHD 4 years ago now. So I've gone through life and I've recognized that strategies that I've created in the workplace for myself are ADHD strategies. So, we work it out. And with, when we're talking about health professionals, that's why let's have a great conversation. Let's collaborate. Let's talk about our strengths and talk about the areas that we need to have to get some support so that we can be authentic. We don't need to mask, and we can have a meaningful life and we can thrive, just like everybody in the world wants to be able to do.
Exactly. It's not different. That's what I keep explaining to people. This is the same thing for everyone. And neurodiversity in healthcare. So we've talked about, healthcare people, please God, learn more about neurodiversity. That is an education. And when you're looking for a healthcare provider, please make sure it's somebody who is comfortable with your neurodiversity. B is the terminology. It's got to go. We've got to rectify that terminology. I want to talk about privilege, though.
Absolutely.
So you and I have had some great discussions on privilege before. So I want to let you dive in first on your thoughts on how privilege affects even, other, particular neurodiverse individuals versus others. How do you think it plays in?
Yeah, absolutely. And I wanted to lost the words. I wanted to highlight that I recognize that what I say is coming from a very privileged lens. I'm a white Australian. I'm very fortunate that we can have private health care. We've been in the public system and the private system. We have choice. We are able to speak up about being authentic. We're able to speak up about, I'm autistic, I'm ADHD without fear of anything coming from that. So I want to recognise it's crucial to recognise that my experience, I have experiences that are hard, but nowhere near what other people might have. Those who are cishet, non-white. We've even read, you sent me a beautiful article from LinkedIn from Sarai. I don't even know how to say it.
I don't remember her name at all, but thank you. Yeah, that was a great article.
Sarai Parla, who, so there's layers of intersectionality. There's layers of systems. There are people who, while we recognise, for example, that ABA is really harmful for autistic children, there are some places where...
Please clarify what ABA is for those who don't know.
Applied behavioural analysis. So ABA is put in place, It's been likened to Pavlov's dog. So
it is kind of like that. I never thought about that, but it is.
So children are mandated in some places. The parents have no choice. That children have to attend 30 hours, for example, a week of ABA, which is intended to cure,
Normalize them.
Normalize an autistic child's behaviour.
Which is horribly damaging. Horribly
it's
damaging.
Hugely damaging. There's massive trauma that comes from that. Oh, the mental health outcomes. So, but there are people. So I recognise. You know, we can advocate and say ABA is harmful. Do not do it. But there are people who are at risk of losing their children if they don't do that. So where I'm coming from is, I recognise that. I recognise I am very lucky to be able to speak up and have this choice, and to try and make change happen. But also recognising that there are those people who we can't shame. You know, we can't say you can't put your child in ABA. If that's a choice between having your child and not having your child, of course you'll do that.
Of course.
So it's about supporting those families outside of that, you know, and providing the information and the ability for them to recover outside of the health system. So yeah, that's where I'm coming from. I wanted to recognise there
are so many types of privilege involved in this. So from that article that you're referencing was about how in different countries in Africa, they basically have to give away their children for them to get any help whatsoever. And even then there's just such limited resources. There's some great charities out there giving it their all, but there's only so much that even they can do. There are Asianic countries that are that way as well. There are South American countries that are that way as well. And honestly, I was surprised when I dove into it how there are some European countries that are really far behind and doing some kind of funky things with no, not Western European. Western Europe's good. Eastern Europe. But still, I was still kind of surprised. I was like, okay, these cultures are a little too advanced for this to be the case. But even even in countries where they're doing fairly good with this, such as Australia, such as United States, such as Canada, I've heard of some weird stuff happening in Canada too. So, and in Germany, I actually just heard a really insane story out of Germany. So it was very similar to the one that you shared. And so even in those places, there's still a very backward view of all this. And I've had people, I've had mothers. It's been very interesting with all of my neurodiversity work. The only people that have ever come at me angry are mothers. And they're angry on behalf of their child. And I always come at them with a lot of compassion, because I know what's happening is they've seen their child hurt by other people's ignorance, and they're just scared for their child. Yeah. They're just trying to protect. So I'm never angry at them for this. And actually, I usually have some very wonderful, productive conversations with them. And one of the things that I tell them is, this is no different than racism. Would you look at your child who was Black and say you shouldn't, we're not going to tell people that you're Black? I mean, even if you could somehow mask that a little bit, it's not gonna work. You are who you are, and you shouldn't shame them because other people are ignorant.
Yes.
But again, from privilege. So there are places where you do need to hide a neurodiversity to protect your child. So I do want to give honor to that. That's not what I'm talking about. That if that's what you need to do, please do it. But in a situation where it's bullying, or it's a stupid school, or it's a stupid doctor that's just ignorant and saying something dumb, remember where the blame goes. It's there. It's not on your kid. There's nothing wrong. To your point that you made earlier, Nicci, there's nothing wrong with them. They're just freaking fine.
And I grew up being told I was quirky, and I owned quirky because I liked who I was.
Yeah.
I'm just seeing what this message says. It was a choice to support my
father. Oh, it says, It's talking about a mixture and moderation. Depending on the type of ABA, I've seen some ABAs that are not bad, that actually just help the person function more and more day to day. That's not exactly what Nicci and I are talking about. We're talking about where they're basically trying to teach them not to work
Be
with
themselves.
their diagnosis. Yeah. So I don't know what exactly you're referring to, but there are ABAs that are actually helpful, that teach you how to work with your condition and how to actually be more functional. That's not what we're talking about. We're talking about the ones that teach you to hide it and to not work with it and to just, be more normal. It's kind of a more abusive approach than what I think you're referring to. Anyway, Nicci, go ahead.
And thank you for sharing that.
Yes, and thank you so much for sharing that. That is important. And moderation is always important with everything.
And also, as we were saying before, we know our children. If something helps our children, I think the most important thing for me is that my children don't have shame about who they are. That they get to celebrate. We just have the best conversations. We have so much laughter and just enjoy each other. And if we had to hide that, my house.
Can you imagine?
Into a musical, and
that's cute.
That does annoy one of my children, but the other joins in. So, where were we?
You talk about knowing your children and not shaming them for who they are.
Yeah. And I mean, I've come a long way from. I mean, now I recognise that when I was first working with health professionals around, firstly, my children, I didn't realise that I was masking, and that I was very compliant, and I was very. I will believe everything because you know best. I don't know best. My gut doesn't know best. So even though I would feel physically sick at some of the suggestions that were being made, I'd still try them with my child. And I could see that they weren't working, and now I can see that they caused harm. So one thing I'm so appreciative of is, as I've learned more about myself and more about neurodiversity and neurodivergence, I might come across as an overprotective mother, but I'm very careful now about, if we are seeing a professional, I will do the research now, and I know the questions to ask to make sure that we're getting a neurodiversity affirmed therapist. So somebody who's going to partner with my family, who's going to walk beside us, and who's going to love. I mean, I know they can't love my children as I do, but who's going to appreciate them like I do.
Right.
Who's going to laugh with the totally rude jokes. And I'm just going to go with the flow and enjoy my kids. That's what it's about.
And that's huge. And self-advocacy is so very important. So I also do want to hit on that point as we're talking about neurodiversity in healthcare, is that you do need to advocate for yourself. And even with the best neurodiverse friendly doctors, for instance, I have the best doctor in the whole wide world. I'm thoroughly convinced. No one will ever convince me otherwise.
Mine's
well, there you go. Maybe they're somehow like linked together. So she is absolutely wonderful. And even with her, I still have to do self-advocating because I'm the only one that knows what's going on with me. So it's not that I have to convince her to listen to me or to treat me. And she's very good about doing a lot of research and things like that, even as we're talking. But I do still have to tell her what's going on, and I have to understand what's happening to me. So I do a lot of, you and I have talked about this before. I do a lot of charting myself and and learning myself and tracking myself. And those things are very important to do. I've shared with you, Nicci, before, you know this story, and I've talked about it a few times, is that I have bipolar 1. I received that diagnosis pretty early on in my life. And I decided I didn't want to do medications because of how some family members of mine responded to medications. But I also knew that was going to take a lot of work, that was going to be a lot of work on my side. And so I charted myself. I learned what caused this. I learned when this cycle happens, do this. This is something I do when I'm in a heavy mania stage. It's dangerous. I can't do that. So what do we do about that? And it became a whole thing. It took me about a decade to really get it right. And along that way, I had helpers, like you were for your friend. I had helpers. I had people that helped me out. And now I can manage very effectively. And then hormones happened, and now I need them occasionally, but only sometimes.
I'm those hormones.
But that's the other thing is, yeah, exactly. As soon as you think you have it right, something will happen. something will happen, and usually hormones, and for men and women it happens, and it'll just throw you off. I know a woman whose bipolar almost disappeared during her pregnancy. Like, it just almost entirely disappeared. Like, it just, for whatever reason, it's just, the pregnancy actually helped her out. So who knows? So it's different for everybody, and you're different, and you're going to change and evolve. But that self-advocacy and that self-knowledge is so very important. So do your research, not just on, to know the right questions, which is highly important as well, but do the research on yourself and learn to understand yourself and how you function and your neurodiversity, because you are different than the other people that your doctor is seeing.
Yeah, exactly. And once again, we're fortunate that we can do that. There are those who find that hard to look in and work that out, and that's something that I have done with neurodivergent people that I've coached, is help bring that out. So firstly, bring out the strengths, because people are so often their deficits are discussed, and so I start the other way. We bring out the strengths, and then around that we talk about, and we start to get to know that self-advocating. So what do I need to keep me well? And to be able to speak up. So have those conversations with your doctors, because it's really hard for some people. They haven't had that power. They don't have that power to speak up, or the words to speak up with. So
it's true, and I do want to give a lot of space for how long. I mean, and even, I mean, it took me a decade to get it right. A freaking decade. That's not short. That is so long. That is so long.
When you told me that, I was like, that's commitment. That's astounding.
I wouldn't give up. I was just determined, and that's so, it can be very draining, and now I'm in such a good place with it, and I'm so happy that I did it. But so I say that as encouragement, but also as empathy to, I get it. It sucks and it's hard, and for different people with different neurodiversities, it can be even harder, because of how they think and how they communicate is not always as well understood by others. And so and also I want to encourage, so I talked about how I literally charted myself and all. I know people who do video diaries and just film themselves. They don't even talk to it. They just film themselves. Like, what did it look like? And then they can show that to their doctor. To have other people journal what they see in them. So if there's somebody that lives with you that can go, on this day, this happened, and this was the behavior, this was the change.
That's great.
So use the different tools in your life and the different humans that love you. And I want to go ahead.
I'm sorry, with ADHD, as I'm butting in.
You're good. Neurodiversity. hey, you're enough ADHD right now. You're enough.
I because I'd go to doctor's appointments and they'd ask me things and I just couldn't remember. I couldn't remember that I had a clot in my lung. I'd forgotten.
Oh my gosh, yeah. I mean, not a big deal, right? Just a clot in your lung. No big deal. So
I've started. It's taken me years to recognize this. This is my hot tip for people who are younger than me. I just document everything now. I keep all my doctor's reports. I've got a file now. I should have done that a lot earlier, but I didn't realize I was ADHD. But I just have a folder, or I've got to have that information, because I just don't remember it. I don't remember what health issues I've had, and I don't remember what doctors have told me, and it gets really overwhelming. So yes, absolutely, use the tools you've got. Get the people around you to remind you. Just have a folder and just stuff things in. Write a little note and stuff it in, because that way you're going to have the information that sometimes your brain won't allow you to remember.
Yeah, absolutely. Because I mean, you can't remember everything. The older you get, the worse it gets, let me tell you. It does not get better with age. And it does. And I have a huge medical folder too. It's hysterical. Now there's actually two of them because it got too big. just keeps adding on. But it's so very important to just find a way to keep that information, to store that information, and to learn yourself. And by the way, folks, I want to hit on, not everything is obvious. So if something happens to you and you don't quite understand it, whether it's physical or a neurodiversity thing, jot it down and give it to your doctor next time, because you never know what's going to make them go, aha, this is the thing. This is the missing piece that we didn't have before. That has happened to me more than once in my long history with dealing with doctors in the medical system. So definitely, just even if it's just something kind of bizarre, just jot it down, and then that's the thing. And I do also want to talk about the safety issue. So I've had, during all of my work, I've had the privilege to meet different people from all over the world with all different neurodiversities, yourself included. And I have also seen that not everybody is in a safe situation for themselves. And sometimes it's where they live. Sometimes it's the people that are around them that don't support them and say nasty things to them and that belittle them. And so I want to stress, don't do that to other humans. Not only is it shitty, it can literally kill a person, because when you're not listening to them and you're dismissive of them, it can literally kill them. So don't do that. And then B is, if you're in that situation, you don't need to be. There are other humans out there that will love you and that will embrace you and that will support you. And you don't need those crummy humans. Fire them from your life. Just to them, move them away, and find your new tribe. I know some incredible, amazing, wonderful, loving humans, and I will introduce you to a whole new tribe that will not suck, that will instead support you. So I did also want to talk about the safety aspect of that, because when people are in an environment where they're not supported with something as important as their health and their neurodiversity, it can go south really fast. Absolutely. And even when they are loved and supported, sometimes it still happens. So take it seriously is my thing. And especially with the mental health stuff, take it seriously. Take it very, very seriously.
What I've found that's beautiful. So there are, there's lots I don't love about social media, but if you find the right groups, there are some groups that are woe is me, terrible life. It's not focusing on shifting and finding positive support, but there are other groups that are holding space for people and helping people recognize if they're not in a safe space. So I was reading that this morning. A person put up their experience of how their brother treats them, and they were questioning, am I imagining this, or is this not safe? And it was great because everybody respectfully were responding, giving them objective viewpoints, supporting them in that space, and giving them active suggestions about how to move away from that, because yes, it wasn't a safe situation.
Right.
So if you find the right places, so those online places are places where people will hold space for you. They won't shame you. They won't they won't lecture you, but they will gently and kindly offer guidance if it's asked for, or just share and just understand that right now this is a hard time. So yeah, you can get that safety in a place that I've traditionally thought is not a safe place. Oh, you've gone.
Oh, yeah. It's the storm. Did I come back? There we go. It's the storm. I told you it happens occasionally. but it is, I wanted to address the safety, and I've lost people to mental health concerns, and it's an awful thing to have happen.
Yeah.
So always when somebody, is going through that, take it seriously. And you can't always help them. You can't always save them. You can't always help them, but take it seriously and be there for them, and don't be pushy and judgy and harsh. And trust me, okay, I get it. I am a pushy, judgy human. Okay. But in that circumstance, don't leave it at the door, and just hear them. And even with somebody who's just new to their diagnosis, and they're safe and they're in a relatively healthy mental space, but they're new to the diagnosis and they just need to be upset about it for a minute. Let them feel it, because it's okay. It's frustrating. It is frustrating when you first get a new diagnosis. But the thing I like to remind people with neurodiversity is that it's actually not new. It may feel new because now there's a name, but this is just you. And now there's just a new term for this piece of you, but it's just you, and it's not really that scary. So sit with them, support them, love them, let them get it all out, but then remind them that just like your pinky, it's just a part of you, and it's okay.
Yeah. Absolutely.
So what are your closing words to our audience, Nicci?
Oh, that's on the spot.
It is, I know. And I'm going to have you close it out. No pressure.
Oh, gosh. My closing words are, I like what we've said, what you said about get to know yourself as well as you can. And if you find the words hard, find others around you who can help you with those words so that you can advocate for yourself. If something in the treatment that you're getting isn't feeling right for you, don't feel that that's about you. Recognize that, trust yourself that this isn't the right solution for you, and keep working at finding the right space that's going to support you to be authentically you, and where you're going to be able to love your strengths, and get support in the areas that are challenges for you.
Those are lovely closing words. I have nothing to add. So thank you all for watching. You can connect with either of us on LinkedIn. In fact, please do. And again, it's Nicci Richman. She is tagged in the post, so you can find her on LinkedIn. Reach out to us. Let us know if you want introductions to other amazing neurodiverse humans. And thank you, everybody. We'll see you again soon.
Thank you. Bye-bye.